It is critically important that patients have access to and have a clear understanding of medical health information. There are many challenges in how healthcare professionals can deliver that. These challenges include time, appropriate resources, and support. Another challenge is having access to tools to combat the vast and often overwhelming volume of medical information that may be misinformation or disinformation. There is vaccine hesitancy, vaccine deliberation, overt refusal of immunization. Lack of appropriate medical information can lead to delays in access of care, including critical and essential mental health care. So ideas to build trust in the communication with patients include starting with an inquiry to patients and their families, trying to gain an understanding of where they are in their understanding of a diagnosis, also gaining an understanding of their cultural beliefs and the context for their concern can then help provide an opportunity to communicate accurate medical information to patients and their families. Physicians and all healthcare workers need to seek resources that are language, age, and health literacy level appropriate. And lastly, I think all physicians and healthcare professionals need to hold ourselves accountable to provide accurate medical information to patients and families in a kind, authentic, humanistic, and professional way.